My name is Johannes Taklebra. Today I'm gonna explain some PEP coughing assist therapy. So for this thing, we just first check the physician orders and check the patient chart, and then collect collect the material we need, like stuffs we need, like a medicine or and the equipment, everything we collected and checked everything is set up, like we got all the the equipment and the medication to give this treatment. And we clean our hands, like we sanitizing ourselves by our hand by for 15 seconds, and after that we entered the patient room. So when we entered the patient room, we explain you explain yourself who you are and why you came for today, and tell them the patient for the treatment precaution, the risks, and the procedures for the patients. Then after that, you ask the patient to continue this treatment if they say okay, or you ask the patient or the relatives or the families or friends if they say okay, yes, and you continue the treatment. So the first thing you did, the first thing you did, yeah, you comfort after you confirm the patient like is okay or not to continue the treatment. The first thing you do is a vital sign, and then you do a measure pulse, respiratory rate, and the saturation assess speed, and then breathe sound, and you do everything, and then assess the symptom of on this treatment. You assess the symptom production and response to spontaneous dry coughing. Then after that, you go to the after that you start to assembling the treatment, like the devices, the mouthpiece, the resistive device, and one-way valve, tubing, and a pressure manometer. So without error and without nothing, uh, um, we should assemble the equipment. After that, then instruct the patient how to use the device. Now we should tell them like how to use the device effectively, and taking a moderately deep breathing. And after the thing, like we just uh, after this we just tell them like the treatment how will be, like, just we should use IE 1 1 2 to 3 to 1 1 ratio 4. Then adjust the resistance setting to generate pressure like 10 to 20 centimeter, and coach the patient to perform 10 to 20 breaths, like. So we should tell them like, and we should coach them 10 to 20 breaths. uh, then the other thing, remove the device and instruct the patient to perform 2 3 half cuff. Like half cuff means, like, just the half cuff treatment. Then that's the second one. And then allow the patient to reset and as needed, like, we should tell them like, we should allow them to allow the patient to reset as needed, and repeat the breathing cycle followed by half coughing, and continue cycle as appropriate but not exceeded 20 minutes. So that's what we do. Then after that, like, assemble the device without error, or correct assembly as necessary, and instruct the patient to tilt and hand slightly actively against the fluid valve without puffing and checking. Then the other, coach the patient repeat cycle. Still, we should coach them this thing doing by themselves for the patient, with easy way, and easy and right way. So after that, we follow up whatever we did the therapy every time, like any therapy we give, like we did, because we should follow up, because we should know we give them the right therapy thing by checking the follow up. So we should check up the pulse rate, respiratory rate, saturation. So we should do again the vital sign at the same time. So then assess the septum production, because First, before we start, we do septum production checkup. Then when we finish with treatment, so we should know how the how the treatment is going by checking. Then and after we finish everything, we contaminated our hands and our material what we use, and wash our hands. And after that, after we did everything, we have record that. So we should record the data what we got everything. So record relevant data on a patient chart, and that's how we do. Thank you.